If you suffer from headaches and constantly wonder, is this something harmless or something serious that I should see a doctor, this video is for you. Hi, I'm Rabea Akram, a neurologist, and in this video I'll share with you 3 headache types that should be taken very seriously and require immediate medical attention. Before we begin, please note that this video is meant for educational and informational purposes only and not a substitute for professional medical consultation. Headache is one of the most common neurological symptoms worldwide, and we divide headache into 2 major categories. These are primary headache and secondary headache. Examples of primary headache are migraine headaches or tension-type headaches, where headache itself is the main issue. In secondary headache, the headache signals another underlying condition, such as infection, bleeding, or raised pressure in the brain. When you come to see a neurologist with a headache, we check for red flags, meaning warning signs that hint a serious underlying problem. Among many other tools, we often use something called the SNOOP mnemonic to remember these red flags. The S in SNOOP stands for systemic signs, such as fever, weight loss, night sweat, known cancer, or known infectious diseases, to name a few. N stands for neurological symptoms, such as numbness or weakness of a part of the body, altered consciousness, confusion, or a facial droop. O stands for older age, especially a new type of headache that is starting for the first time after the age of 50. P stands for progressive pattern or pattern change, meaning a headache that becomes worse over time or changes its usual pattern. The second P stands for positional or precipitated, meaning that the headache is triggered by things such as sneezing, coughing, or changing the position. At this point, I want to mention that please note that this is not a comprehensive list, and there may be many other red flags which are not included in this list. The idea was to give you a general idea about the concept of red flags. If one or more red flags is present, we neurologists urgently investigate with imaging and other tests to rule out serious causes. On the other hand, if the headache is familiar, matching your regular, usual headache pattern, and you have no red flags, plus you have an already diagnosed primary type of headache, like, for example, migraine or tension-type headache, it can usually be managed with the guidance of your doctor with prescribed medication or other tools that you may have learned from your doctor. If you would like to learn more about how you can improve your migraine naturally, you might want to check out my video where I talk about natural ways how you can improve your migraine frequency, attacks, and durations. Now that we understand the concept of red flags and why they matter, let's take a closer look at 3 specific types of headaches that often present with these types of warning signs and may indicate a serious underlying issue. Number 1 is high blood pressure related or hypertensive headache. Undiagnosed or uncontrolled high blood pressure can manifest as a headache, especially when blood pressure reaches dangerously high levels. These headaches often present as throbbing, pulsating, pressure-like pain, typically on both sides of the head or at the back of the head and the neck. They may be accompanied by nausea, blurred vision, dizziness, light sensitivity, shortness of breath, and even chest discomfort. In more severe cases, vomiting and nosebleeds may occur. In healthy individuals, following the natural circadian rhythm, blood pressure typically drops at night during sleep. But in people with high blood pressure or hypertension, this dip of blood pressure during the night may not occur, and blood pressure may even peak during the night, often leading to morning headaches or frequent awakenings during the night with headache. If you suffer from this type of headaches, without any delay, speak to your doctor about it and bring up the topic of doing a 24-hour to 72 hours blood pressure monitoring, which might end up detecting an undiagnosed high blood pressure. Wearable devices that track blood pressure can also be helpful. Long-term untreated high blood pressure can not only give you headaches, but can also cause damages to the blood vessels in your brain, increasing the risk for stroke or vascular type of dementia, and cause premature aging of the brain. So it's very important to address this type of headaches early on. Number 2 is headaches with neurological symptoms. A headache that's accompanied by other neurological symptoms should always raise concern. Neurological symptoms include tingling or numbness, either of a part of the body, of the face, or an arm or leg, weakness of a certain group of muscles, either of the arm, leg, or any other part of the body, drooping of a corner of the mouth or of the eyelid, difficulty in understanding speech or difficulty in speaking, change in personality, behavior, change in consciousness, double vision or vision loss. These are some examples of neurological symptoms. Again, this list is not comprehensive and there can be many other types of neurological symptoms, but it gives you a general idea. These symptoms may be warning signs of serious underlying conditions such as stroke, brain tumor, inflammation or infection either in the brain or its surrounding tissue, and should be taken very seriously. If any such neurological symptoms occur, even briefly, one should immediately seek medical attention. Time is critical, especially in cases such as stroke, where every minute of delay can cause irreversible damage to the brain. Number 3 is thunderclap headache caused by subarachnoid hemorrhage. A subarachnoid hemorrhage is a type of bleeding in the space surrounding the brain and is one of the most serious causes of headache. A hallmark symptom is a sudden, extremely severe headache, often described as a thunderclap because it reaches its maximum within seconds. People commonly describe it as the worst headache of their life. Other possible symptoms include nausea and vomiting, sensitivity to light, stiffness on the neck, dizziness, confusion, seizure, and a loss of consciousness. In the days following a subarachnoidal hemorrhage, further stroke-like symptoms may appear depending on the area of the brain that has been affected. Typical examples include weakness, numbness, or paralysis on one side of the body, speech difficulties, problems maintaining balance or walking, and in severe cases, even coma. This is a true medical emergency. Diagnostics is usually done in the emergency room using brain imaging such as CT scan or MRI scan. And if imaging is not conclusive and suspicion remains high, a lumbar puncture may be conducted to look for blood in the cerebrospinal fluid. So if anybody ever experiences a headache like this, a sudden, explosive, and intense thunderclap type of headache, seek immediate medical attention. Early diagnosis and treatment can be life-saving. These were the 3 serious causes of headache that should never be ignored. If you found this video helpful, give it a thumbs up and subscribe for more neurology insights.